Did you know that some fractures heal much slower than others? This delay is not random. It always has a reason. Normally, bones heal through a well-organized biological process. Good blood supply is essential for bone repair. Smoking is one of the most common causes of delayed healing. Nicotine reduces blood flow and oxygen reaching the bone. Diabetes is another major factor. High blood sugar damages circulation and slows bone cell repair. Bones also need proper nutrition to heal. Without enough protein, calcium, and vitamin D, healing becomes weak and slow. Stability is just as important as biology. An unstable fracture cannot heal properly. Proper fixation and correct medical care make a huge difference. Delayed healing is not about time, it is about the cause. When you treat the cause, healing improves. Follow for trusted bone health advice.